So as a conclusion lah sikit-sikit, alright. So bukan conclusion, few slides just to recap. HPV DNA. Okay, I know many GPs out there. Alright, what should be offered? Actually, you should cari liaise with the lab. You want the HR HPV only. Right, bukan dia tak boleh buat low risk, but of course kalau you ada patient yang genital ward ke apa ke, then you nak confirm, then different. But in order for cervical screening, you're talking about you ambil tu untuk cervical screening, bukan untuk merisaukan patient, bukan untuk untungkan you je. But in order for cervical screening is HR HPV. Dia beberapa 14 atau 15 HR HPV itu saja. And it should be PCR based. Alright, you should confirm with the lab you nak PCR based. And the best is self-testing, alright? Because kalau you serious, of course, ada yang pernah berulang dengan GP not really keen because then you cannot charge the speculum, you cannot charge the technique. That another thing talking about this, but I think if you offer self-testing, you will be more coverage. Okay, means bagi banyak, so you punya sales akan jadi banyak rather than pap smear, because not all, unless you need to do a speculum or the patient because of any other reasons. Okay, patient ada abnormal bleeding ke, alright, any reason, ada discharge ke apa, and for you to do the speculum, then you can offer the clinician based testing. But if not, I think with self testing the acceptance will be higher. Right, studies have shown many women actually comfortable with self-testing. Where to send? Okay, so this is so kalau you and GP, then you need to liaise with your lab, with your outsourced lab to pilih yang mana yang boleh hantar self-testing. Alright, satu yang no need the of course majority of the lab memang boleh buat the LBC one yang masuk sekali dalam dengan pap smear, but try to arrange for the self-testing. Alright, dia memang ada lab yang bukan ada, memang they should, kalau tu you just emphasize on that. Because lab ni kebanyakannya kalau tak ada demand, saya pernah berat dengan lab, dia kenapa sebab doktor tak minta, no demand. Alright, because of that they don't provide the kit, they don't provide the assay for the test and all that. So you should have the demand, right? You should request. Okay, dan tunjuklah, this is now point, my selling point yang saya pernah cakap dengan the lab. Kalau you tak provide, the KM had already implement this. So the patient akan cakap lah, kenapa dekat KK boleh provide benda yang better, not in the GP? Then they expect in the GP actually it's a better punya performance test, alright? So they need to another thing is query collaboration with KKM. Okay, there's another thing, kalau memang you punya kat kawasan you lab tak nak buat hantar semua, you can try to arrange collaboration with KKM. Means you are win-win. Okay, I mean that's a discussion yang I boleh bagi suggestion je, but you all need to discuss with your local punya tempat. Okay, either you collaboration means you help to get the test, okay, from KKM, but you ambil some portion for the outreach, for example, for your consumables, for your registration and all that. Need to have some agreement. That's only my suggestion lah. Okay, you should discuss at your own level. Okay. Okay, so what to do? Of course, kita dah explain tadi, HR, HPV only, right? You refer for colposcopy, you need to arrange. So before you offer, this is important for GP, for example, you not start offer this anti-HPV test, for example. You need to arrange from the beginning what to do if positive. Jangan tak tahu, alamak, bila dah ni baru tak tahu. Tak betul nak buat apa. No, you need to arrange from the beginning. Okay, positive, okay, this is a pathway. You offer either government punya line, or hopefully the expedite punya line, ataupun yang private. Okay, ada hospital mana yang nak refer. Alright, so that's important. Of course, kalau punya test, you buat test yang semua, you dapat low risk HPV, you reassure, janganlah oh ini sama juga, janganlah you increase lagi the burden yang unnecessary, and the patient HPV 6, 11 positive ke, you hantar for colposcopy, then it's not appropriate also. Alright. Of course, negative you can choose. Maybe in GP I would suggest repeat in 5 years. Okay, because sometimes we miss. Not say because of the sales and business, we afraid that we lost the patient. The patient, 10 years, sekarang dia pun sendiri tak ingat. Alright, but you can say to the patient 5 to 10 years. Oh, okay, bagi appointment 5 years, reminder ke untuk dia. Alright, then dia kata dia nak buat tahun depan lah, it's okay, 6 years, 7 years. Alright, and need to think about, okay, how the patient feel before getting the result. This is important. So you need to acquire the skills of counselling. You need to know what to do. You need to prepare to answer questions. I dah bagi dah tadi many questions that memang kita jawab pun tiap kali pergi kolposcopy klinik pun. Alright, macam mana saya dapat, husband saya ni ada promiscuity ke, saya kena ambil ubat ke tak, husband saya kena treat ke tak, bla bla bla, benda-benda macam tu yang kena prepare. That's the importance of knowledge, it's important of CME for example. Dan sebab tu kita orang buat free for this session. Counseling, okay, that's need to. I just repeat balik again, just a reminder as a recap. This is a take-home message: 90, 70, 90, 90 and 70. The first and second pillar directly to primary care. So I just reiterate back, directly to primary care. Vaccination, okay. Primary care means yang the public one, public program is this KKM and Kementerian Pelajaran. Itu another thing. But ada juga yang dekat situ part of private GP punya rules juga dekat situ. Okay, maybe yang ni you remind untuk to the program, ataupun kalau yang memang not comfortable with, I mean dia nak from the private punya ni, then you should offer, right? 70, the screening is very important. Okay, I think maybe half of the bulk actually should be taken by the private primary care, alright, in helping your business also, and helping the patients and helping the country to achieve the target by 2030, right? And the third pillar 90 tu mostly us, okay, gynecology, oncologists, radiotherapists in the hospital, but also actually you have the role of identifying and referring, okay? Okay, so together let's eliminate cervical cancer. It's our role, it's not somebody else's role, it's our role together, all right? Okay, I think thank you for the time, for the your role. I would think thank you for your role actually. By having CME pun you dah nampak the what you call that, your effort to join the effort to eliminate cervical cancer. Congratulations for that. And okay, this is part of our like contribution lah. Okay, at least to educate and to emphasize on that. I will happy to receive question yang I boleh jawab, saya jawab. Yang tak boleh jawab, kita directkan you kepada yang boleh, ataupun kita jawab kemudian. So just nak continue iklan juga. So this is part of outpatient gynecology webinar series, mainly webinar lah, okay. But kita akan ada yang maybe yang memang face to face is important, because along the way tu kita ada yang together with the hands on, like the contraception one apa semua, we'll update later. But please, I think nanti Yasir pun akan explain how to follow, and also to keep up to date to our next courses. But this is a tentative date. For now, we have already open for yang endometriosis lah, yang 4 series tu kita dah start the registration. But the next topic had been there. You can follow us for more information lah. Okay.